Assalamualaikum and good afternoon to everyone and welcome to my presentation. First of all, let me thank you all for coming here today. Let me start by saying a few words about my own background. And as you can see on the screen, our topic today is COVID vaccination. And what is COVID? As you know, COVID-19 is coronavirus disease. Is an infectious disease caused by the SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatments. And however, some will become seriously ill and require medical attention. Okay, presently the impact of COVID-19 in daily life are extensive and have far-reaching consequences. This can be divided in various categories. Okay, firstly, effect of COVID is on healthcare, which is high burden of the functioning of the existing medical system. And secondly, patients with other risks and health problems are getting neglected. And for economy, also disrupt the supply chain of product, slowing of manufacturing if essential good. And thirdly, social. Service sector is not being able to provide their proper social, and also cancellation and postpone large-scale sports and tournament can affect our country also.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by Day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, Day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on Day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
My name is Muhammad Faris Izzuddin bin Jainuddin and my metri number is F90A0085. So today I'm gonna explain about how the COVID-19 virus could be spread. The virus can be disseminated in 3 different ways, which is the first one, close contact. The virus mostly transmit between persons who are in close proximity to one another, such as at a conversational distance. When an infected person coughs, sneezes, speaks, sings, or breathes, the virus spreads in little liquid particles from their mouth or nose. When infected particles in the air are breathed at close range, this is known as short-range aerosol or short-range airborne transmission. Or when infectious particles come into direct contact with the eyes, nose, or mouth, another person can get the virus. The second one is inhalation. The virus can also spread in poorly ventilated and congested interior environments where people spend more time. This is due to the fact that aerosol can linger in the air or travel beyond than a conversational distance. This is often called long-range aerosol or long-range airborne transmission. The third one is touching. People can become infected by touching their eyes, nose, or mouth after contacting surfaces or teeth that contaminated with the virus. So far, the data suggests that the virus spread from the person to person by minute respiratory droplet. This droplet might land on neighboring surfaces when a person coughs or sneezes. This is also evident that the COVID-19 virus may survive for up to 3 days on surfaces, particularly plastic or metal.
Hi, I'm Wani.Ismail and my metric number is F19A0043. For my part, I will explain about what is vaccine. As we all know, vaccines are designed to prevent disease rather than treat it. They do this by priming a person's immune system to recognize a specific disease causing bacteria, virus, or other pathogen. Vaccine is also a simple, safe, and effective way of protecting our against harmful disease. It also uses our body's natural defense to be resistant to specific infection and make our immune system stronger. Vaccine train our body system to create antibodies thus when it's exposed to a disease. However, because vaccines contain only kill or weak forms of germs like virus or bacteria, they do not cause the disease or put us at risk of its complications. How COVID-19 vaccine work? COVID-19 vaccine will help our bodies to develop immunity to the virus that cause COVID-19 without us having to get the illness. Different types of vaccine work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory. It's known as T lymphocyte as well as B lymphocytes that will remember how to fight that virus in the future. It's typical take a few weeks after vaccination for the body to produce T lymphocyte and B lymphocyte. Therefore, it is possible that a person could be infected with the virus that caused COVID-19 just before or just after vaccination, and then they get sick because the vaccine did not enough time to provide protections. Sometimes after vaccination, the progress of building immunity can cause symptoms such as fever. These symptoms are normal and are signs that the body is building immunity. The side effects of COVID-19 vaccine, they have 3. The first one is common side effect of COVID-19 vaccine. These occurring after vaccination differ according to the specific vaccine. It's like pain at the injection site, fever, fatigue, herpes, muscle, cysts, and their holes. And the second one is less common side effect. Side effects lasting more than 3 days is like allergic reactions such as anaphylaxis. This reaction is extreme rare. And the lastly is long-term side effect. This occurs within the first few days of getting a vaccine. It's possible a person could be infected with SARS-CoV-2 just before or after vaccination and still get sick with COVID-19. This is because the vaccine has not yet had enough time to provide protection for our body.
Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Syabil Adham bin Suhardi and my matric number is F19A0212. Next, I'm going to explain the different types of vaccines that is used in the making of the COVID-19 vaccine, which is the whole microbe approach, the subunit approach, and the genetic approach. First, we will take a look at the whole microbe approach. It is further divided into 3. The first is inactivated vaccine. The first way to make this vaccine is to take the disease-carrying virus or bacterium and inactivate it or killing it by using chemical, heat, and radiation. This approach uses technology that has been proven to work in people, and this vaccine can be manufactured on a reasonable scale. Influenza vaccine is the common vaccine that uses this approach. However, it requires special laboratory facilities to grow the virus safely, can have relatively long production time, and will likely require 2 or 3 doses to be administered. Sinovac and Sinopharm are some of the COVID-19 vaccine that use this approach. Second is live attenuated vaccine. This vaccine uses a living but weakened version of the virus. The measles, mumps, rubella, chickenpox, shingles vaccine are the example of this type of vaccine. This approach uses similar technology to the inactivated vaccine and can be manufactured at scale. However, vaccine like this may not be suitable for people with compromised immune systems. COVID-19 vaccine that uses this approach is Codagenix. Third is viral vector vaccine. This type of vaccine uses a safe virus to deliver specific subparts or protein of the germ of interest so that it can trigger an immune response without causing disease. To do this, the instruction for making particular parts of the pathogen of interest are inserted into a safe virus. The safe virus then serves as platform or vector to deliver the protein into the body, and the protein will trigger the immune response. The Ebola vaccine is a viral vector vaccine. This type can generate strong immune response and can be developed rapidly. Some of the COVID-19 vaccine are AstraZeneca, Johnson & Johnson, CanSino, and Sputnik. Okay, the next approach is the subunit approach. Subunit vaccine is one that only uses the very specific part or the subunits of the virus or bacterium, such as protein and sugars, that the immune system needs to recognize. It doesn't contain the whole microbe or use a safe virus as a vector. Most of the vaccine on the childhood schedule are subunit vaccine, protecting people from disease such as cough, tetanus, diphtheria, and meningococcal meningitis. This approach have good previous safety records and usually administered with adjuvant to boost immune response. The example of this vaccine is Novavax. And the last approach is the genetic approach. It is also known as nucleic acid vaccine, which it uses a section or segment of genetic material from the virus that provide the instruction for specific proteins, not the whole macro. DNA and RNA are the instruction in our cell that used to make protein. In our cell, DNA is first turned into messenger RNA or mRNA, which is then used as the blueprint to make specific proteins that we want in our immune system to be recognized and respond to. This approach is a new way of developing vaccines. It is low cost and fast to develop. COVID-19 vaccine that uses this approach is Pfizer and Moderna.
The most important for COVID-19 vaccine is who should be the first one to receive a vaccine. Each nation must select priority population, which the WHO says include frontline health workers such as doctors and nurses, and those most at risk of mortality from COVID-19, such as older person and those with particular medical disorder. Teachers and social workers should be prioritized next, followed by further group as more vaccine doses become more available. Children and adolescents have a very low risk of serious COVID-19 disease. Thus, unless they are part of a group at higher risk of severe COVID-19, it is less necessary to vaccinate them than these priority categories. The most important for COVID-19 vaccine is who should be the first one to receive a vaccine. Each nation must select priority population, which the WHO says include frontline health workers such as doctors and nurses, and those most at risk of mortality from COVID-19, such as older person and those with particular medical disorder. Teachers and social workers should be prioritized next, followed by further group as more vaccine doses become more available. Children and adolescents have a very low risk of serious COVID-19 disease. Thus, unless they are part of a group at higher risk of severe COVID-19, it is less necessary to vaccinate them than these priority categories. In conclusion, since clinical study on these vaccinations only started years ago and population's wide rollout is still beginning, there is insufficient information on how long current doses of protection last and if a booster dose would be useful and for whom. However, research today show that mRNA, Pfizer and Moderna vaccines have extraordinarily high and long-lasting efficiency against severe disease. The worldwide availability of COVID-19 vaccination should be improved. The greatest threat we face right now is not a loss in vaccination efficiency, but millions of individuals who do not have access to vaccines. It is critical that the international community puts the most vulnerable individuals and healthcare personnel first, as many nations still lack of protection from COVID-19 disease. That's all from us. Thank you.